Okay, so hello everyone, and welcome to the webinar. Am I audible? If yes, please drop a yes in the chat box. Okay, okay, right. Thank you, thank you. All right. So we'll start off, and if meanwhile, if you have any queries, you can write in the chat box, and in the end, we'll definitely be dealing with the queries one-to-one. All right. So, okay. So let's start with a bit about myself. I'm Dr. Aashna Verma. I'm MBBS in MD Pediatrics and have done MRCPCH. Last year I have cleared all the parts, and because it is such a recent thing for me, and having done my part 1 in Feb 2023, September 2023 I did my AKP, and then my clinical in Feb 2024. So, I'm a recent pass out for MRCPCH, and hence I feel I can, understand your situation, conditions, and queries, confusions in a better way. Okay. So, right. And I'm currently a practicing pediatrician, and I'm now a mentor with MRCP, med exam expert for MRCPCH preparation. All right. So let's start off with the scope of MRCPCH. And as we all know, it is a member of Royal College of Pediatrics and Child Health. And, it is such a prestigious qualifications for pediatricians across the world. And, it is recognized in almost, all the countries across the world. And it plays a significant role in career development of a pediatrician. So this is one such exam, which assesses your, clinical skills and management skills and your knowledge in such depth that if you clear all the theory and clinical part of this exam, you come out to be a competent pediatrician, So this exam makes sure that you know every bit and every nook and corner of pediatrics. So yes. Okay, definitely this exam is a pathway to UK. If you want to practice in UK as a pediatrician, you need to qualify and clear this exam. And after having passed this exam, you practice in UK as a registrar, okay? So a registrar is, a bridging gap between the consultant and the trainees. And registrar themselves are, it's a training post. So there is ST1 to ST7 and 8 categorization of the level of trainees in NHS. So when we give and clear this exam, we enter at the stage of ST4 and ST5. And so yes, that is the registrar post. And let's make it clear that we do not have the eligibility to practice as an independent consultant in UK, having passed MRCPCH. So we have to do this exam, we have to clear, and then we have to do 3 to 4 years of training in their system to be eligible to be a consultant in UK. Right. So yes, the General Medical Council of UK. So if you want to get registered with the General Medical Council in UK to practice there, you need to clear this exam, and you also need to clear the English proficiency test, that is OET and IELTS. So having cleared both these two, you get, the fully registered medical practitioners clearance from the GMC to practice in UK. Right. So moving on with the scope of MRCPCH, you have professional recognition. So definitely, once you get this degree, you are seen as someone who has certain standard of knowledge and competency in pediatrics, and it does enhance one's CV. So if you want to apply to a post or a job in your own home country, especially in the Southeast Asian countries, this degree is considered to be a well-recognized and considered a highly professional one. So yes, it gives us a upper hand if we have it and if we have cleared it. And about career advancement, yes, it does help us get higher post in our setup, having cleared this degree. Yes, when it comes to knowledge and skills, yes, definitely this preparation and the rigorous assessment that we go through during this exam, it does make you a better and a knowledgeable pediatrician. Okay, so yes, what after getting MRCPCH degree? So you get registered with the RCPCH, which is Royal College of Pediatrics and Child Health, and they conduct a lot of CPD. CPD is continuing professional development. So we get access to their conferences, their workshops, and also some of their journals, having been a member of Royal College of Pediatrics and Child Health. So yes, that is also one of the advantage that we get. And about research in academia, see, while doing this preparation for this exam, definitely you are assessed for the research skills also. Okay, so yes, when you prepare for it, when you clear it, you have a good knowledge about the research projects, about the research tools, and hence you open more opportunities for yourself in the research area. And yes, teaching also, same thing applies there as well. And about contributing to healthcare qualities, see, we have a lot of audits and quality improvement projects that we learn about all through this exam. Maybe not in the part 1, but in part 2 and in clinical exam, these informations are important. And once you know them, once you have the basics of them, you will be in a better position to be able to lead such projects in your own hospital and your the institute that you work in. So yes, about this exam comprises of 3 theory exams, that is Foundation of Practice, FOP theory exam, Theory and Science, TAS, that is also one of the exams, and both these exams form part 1 of MRCPCH. So it is conducted twice a year in February, June, and October. And the good thing about this exam is you can sit for FOP and TAS together. And if you want, you can sit for both these exams separately in different settings. So this is one good thing. And then comes Applied Knowledge and Practice, AKP. That comprises part 2 of MRCPCH theory exam. This is also conducted in 3 different settings in January, May, and September. So the good news here is, for these 3 theory exams, there is no preset rule that you have to sit for part 1 first and then for part 2. If you want, if you're confident, you can go for AKP first and then for part 1, that is FOP and TAS. So yes, you have that luxury. But when it comes to MRCPCH clinical exam, you need to clear your part 1 and part 2 theory exams. You need to be, you need to have passed all 3 theory exams to be in a position to be eligible to appear for clinical exam. Okay, right. So talking about the exam format, we have TAS, which assesses your basic scientific knowledge, the knowledge about physiology and pharmacology. So it deals with pediatrics, but the basic part, the initial learning that we do, anatomy, physiology, and pharmacology that we do in the initial years of our training, that is being assessed in TAS exam. Whereas in FOP exam, you are assessed for the clinical or the applied knowledge, and they basically want your understanding about the diagnosis and about decision making related to the diagnosis. Okay, so it is more of clinical in FOP. Whereas when it comes to AKP, it is similar to FOP, but it is little more advanced. They assess your they assess your finer skills and deeper skills and understanding about the subject. So this was about the theory exam, and it is a computer-based exam. It is conducted thrice a year. For all the theory exams, it is conducted thrice. And if you sit for FOP and TAS together, so you will be giving FOP in the morning session and TAS in the afternoon session. And if you're appearing for this exam separately, still you will be appearing for FOP in the morning. And if you appear for TS alone, you come in the afternoon and you attend it in the afternoon session. So yes. And about AKP has two parts, AKP 1 and AKP 2. It is also conducted on the same day in two different sessions, that is morning and afternoon session. Okay, right. So one more thing about FOP and TS I would like to let you know is, if you are confused and if you have this doubt that if do I need to sit for this exam together, or do I sit for both these exams separately, I would like to tell you that it is always better to sit for both these exams together, because the syllabus is same for both these exams. Okay, the area where they assess your knowledge is same, the topics are same, just that the type of questions or the area of assessment is different. Like if you are asked about a question in celiac disease, and if it is your TS exam, maybe they'll ask you the pathogenesis of the disease and maybe the investigations that are relevant in the case. But if it is FOP, they might give you a clinical scenario about a baby who is having features of celiac disease, and then you are asked to make the diagnosis. And when it comes to AKP, maybe it will be a 2-3 steps in reaching to the diagnosis, in reaching to the answer. Like they might give you a clinical scenario, then you will have to make the diagnosis of celiac disease yourself, and then they might ask you what is the next best investigation to go for in this patient. So So clinical exam. Clinical exam is, okay, you appear for this exam when you have cleared your theory exam, and it is advisable, okay, mark my word, it is advisable to have 2.5 years of experience in pediatrics. That is what is mentioned by the MRCPCH. But the click here is, it is not mandatory, okay? It is not mandatory. So if you are someone who is not having 2.5 years of experience in pediatrics, it is fine. You can still appear for this exam, but it is, yes, definitely advisable for you to have some experience in it. And you need to be really strong with your clinical skills, and you must know how to deal with pediatric patient in real life. So clinical exam is also conducted in 3 types in UK, but for overseas, it varies from country to country. In some countries it is, conducted once a year. In other countries, it is conducted twice a year. So waiting period for the exam is 6 months to 1 year, and sometimes even up to 2 years in some countries. Like, due to COVID, there is a lot of, there are a lot of candidates who have cleared their theory exams and they are yet to appear for the clinical. So that is how, the waiting period is, it has increased. And yes, preparation time for clinical exam is somewhere between 6 months to 1 year, depending upon your experience and knowledge in pediatrics. So yeah, and it is also advised, that you practice with your partner on and off. It is advisable for you to practice on a daily basis before appearing for your clinical exam. So focusing on the theory exams, there are some changes in the exam format which has been brought up by the MRCPCH, and now there will be 100 questions which will be of best of 5 single best answer type. That is, it will be multiple choice question. You'll be given a question and 5 options, and one option out of those 5 will be correct. So this is the most common format of the question that we get in most of the competitive exams across the world, and it has been brought up by MRCPCH so that there is a standardized type of questions and the standardized assessment format for their exam. They do not want to make it difficult for you, or they do not want to make it they do not want to make it difficult for you or so. The exam level is going to be same, just that the pattern has been, it will be same for all the questions. All the 100 questions will be of same type. Earlier, there were different type of questions like extended matching format. Now, they won't be there now. And each question would be worth 1 mark. All the questions have similar weightage, and the time allotted has reduced to 120 minutes. Okay, initially it was more, now it has reduced to 120 minutes, which is good enough amount of time. Okay, you won't fall short of time with this much time given to you. So how to prepare for FOP and TAS? Right. So when we prepare for being a clinician, the best way of doing it is by reading your core books in and out, and reading your books in and out, and having all your concepts really clear, and it should be in such a way that you are able to apply your knowledge in your everyday practice. So definitely an intense learning, intense reading is unmatched, and nothing can replace it. But I would say when it comes to appearing for an exam, when it comes to preparing for an exam, there is a wise way of studying which you should do, which will help you fetch better results in limited amount of time. Okay, because most of us, we are preparing for this exam and also practicing, so everyone has crunch of time with some other reason. So here we will be discussing the best and the wise way of studying for these theory exams. Okay, right. So first and the foremost thing is have strong intention. What do I mean with this is, when we start thinking about appearing for this exam, initially there is dilemma, either to sit for it or not, either to give so much energy to this or not. But I must say that you need to have strong intention before you start preparing for it. And once you have it clear in your mind that yes, I need to do it and I want to do it in the first attempt, in the first go itself, you are halfway done. Okay, believe me, this exam is doable. It is not very difficult. It is a little tricky, and you need to do it properly. You need to practice properly to crack it, but it is not very difficult, right? So have strong intention, and moreover, you need to start studying well before you book your exam, because exam booking somewhere occurs around 2 months before the actual exam, 2.5 months. So you need to prepare well before your booking dates, and you need to have in your mind, like if starting from this point, you need to make clear that okay, if I have to do it by Feb, then this is going to be my planning, this is going to be my schedule all through the months in between. Okay, so yeah, and then know your exam well. See, it is important to know your exam and what areas they assess you, how do they assess you, and what conditions are important for them. Every country has some set of disease which is very common in your clinical setup. So when it comes to UK, diseases like asthma, allergy, and celiac disease, all these kind of diseases are quite common. When it comes to maybe India, Pakistan, and Bangladesh, and maybe countries like Malaysia, Singapore, we do not see some of the condition this common, which we see in UK. So they give importance to that, which is but obvious. And you need to make sure that you're clear with them. So there are areas which are repeatedly being assessed every year, okay, in every diet. And those are the areas which you cannot miss upon, okay? So that is what is know your exam all about, okay? You need to know how they frame their questions and how do they, repeat the topics every year, which questions, which topics are important for them. And that way you understand, how much weightage you have to give to a particular topic, right? So then comes identify high yielding topics and pattern recognition. So you'll always see that when it comes to UTI, certain kind of questions are, assessed every time, like investigations that you'll have to do in UTI, okay? And what are the organisms involved in the pathogenesis of UTI? So there are some topics which are being assessed, and there are some subtopics also within those topics which are assessed more or less every year, okay? So you have to identify high yielding topics, and yes, make notes. I would say that making notes is something which some of us are not very, used to or comfortable to, but it comes very handy, You need to be in a position to be able to revise the entire syllabus around 15 days before your exams. So yes, it will be possible if you have good notes with you. And it is best if you have your own notes, that if you are not used to or not able to make notes on your own, then we are there for your help. And yes, revise. Revision is a very, very, very important process of your preparation. And not revising is a big blunder, which I can say a candidate can do. So yeah, coming to duration of preparation. So this is one very important and common question that I come across. Many students want to know, like, which next exam shall they target, because they want to know how much duration it takes to prepare for FOP and TAS. So if you're appearing for both the exams, or if you're appearing for these exams individually, more or less the duration time would remain the same. And if you are if you are someone new to pediatrics, I would say you should have at least 6 months in your hand, because it is also important to understand the concept of pediatrics in a good way to be able to appear for these exams, okay? So if you are new to it, have 6 months in your hand. And if you are someone who has already done training in pediatrics, like if you have already done your MBBS and MD pediatrics, if you are already someone who has done that, or if you have appeared for other exams like maybe DCH or DMB, so I would say that in that case you have good knowledge about pediatrics. All that you have to do is brush up with the topics that are important for MRCPCH, and also the way the questions are asked there, okay? Because they are assessing more of your clinical judgment than your, the facts, okay? So it depends. The duration of preparation depends, but for a newbie, I would say 6 months. You should give 6 months at least. And for someone who is experienced, who knows pediatrics well, they can, prepare with just 4 months with hand, and sometimes even 2 months in hand, okay? That is also good for some of the candidates. So yeah, resources for FOP. Now, there are a lot of resources, okay? A lot of resources out there, and especially with the advancement and a lot of generous people on internet who share, so much resource and so many books. We have a lot of them available, but these are the must-do, few handful of must-do resource, starting with the clinical cases for MRCPCH, Foundation of Practice. So this book, the first book, is one such book, which is recommended from RCPCH themselves. Okay, so I would say that if RCPCH themselves are giving a book to you to prepare for MRCPCH, why not do it? Okay, you should do it. It's a must do. And then comes Science of Pediatrics. That this is also a recommendation by RCPCH, and it is a very good book. Be it your FOP exam or TS exam, this book is a good one to go for. Okay, and then comes your illustrated textbook of pediatrics. Just a minute. Illustrated textbook of pediatrics is a good one, and it is important if you are preparing for FOP. And then comes pediatric guidelines and neonatal guidelines. So these are guidelines about common conditions that we come across in our day-to-day practice, like asthma, UTI, and conditions like nostril aneurysms. So these are certain guidelines which are given by the NHS and by the UK health system. So it is important to read them because it might differ a little with what we practice in our setup, because it varies from country to country and also from the setup to setup. So it is important to be thorough with their guidelines, right? And similarly, NICE guidelines. But the good thing is you need not know all the guidelines and all the. Okay, so someone is saying my PPT is not moving. So the current slide which I have on is useful resources of FOP. Is it visible to you? Please say yes. Okay, so I have got yes. Right, so the slide which I'm currently on is useful resources of FOP. And I'm moving a little slow, I guess. That's why you got confused that my slide is not moving. Okay, if it's still not moving and it's still not working, do let me know, okay? I got yes from other candidates. Right. So we were talking about guidelines. So yes, do not worry. You do not have to go through and know all, guidelines of all the conditions. There are certain conditions which are important and which is asked repeatedly, like asthma, UTI. So these are the conditions that you need to know the guidelines thoroughly. Okay. Okay. Then coming to RCPCH sample paper, again, it is provided by the RCPCH itself. So it is a must do. Moreover, we mostly solve recalls. Okay. So recalls are past year questions, and they form a very important resource of your preparation. And recalls are so must do, you must do, because they tell you what are the important and the high yielding topics. So yes, recalls are one of the important component, but there is one click. Recalls are mostly something which is written by or told by a student who has already appeared for the exam. So it is completely based on recall. Okay, so most of the times the entire statement and entire question is not being able to reproduce, and they just pick up and join the keywords that they remember from the question. So all the recalls that you see are shorter, they comprise of the all keywords, which is a little misleading, because when you actually see the sample paper, when you actually appear for the exam, you get to know that the questions are not very small. Okay, they have longer stem, and there are a lot of distractors in between. So it is important this way to solve the sample papers, because in those questions they have actually framed it of a similar kind that which comes in the exam. So it gives you an idea of how long the questions are and how much time you need to give to each question. Okay, and there will be distractors, like some of the lines may be not relevant to the answer, might not be relevant to the question, but you need to pick the keywords. Okay, so yeah, useful resources for TAS. Again, clinical cases for TAS given by RCPCH is one important resource, and science of pediatrics particularly is very, very, very important when it comes to TAS, okay? I have read this book thoroughly, okay, for my exam, and I'm again reading it very thoroughly to, be able to answer all your queries and make you thorough with the topic of TAS in the upcoming crash course of MRCPCH. And yes, again, the RCPCH sample paper, past recalls, and pharmacology files and ethics files. Ethics files, these are some PDFs which are being circulated on the online portal by generous people online, and they are really, really, very helpful. So we have it in our group as well, in WhatsApp group. It will be shared if you want. Right. So talking about the last 2 months of preparation, if we have anyone around here who is preparing for the upcoming October FOP and TS, do give me a hi, do give me a yes, so that I can talk to you one-to-one and discuss this particular slide in more depth. Right. So last 2 months, if you have made notes, it is best to read your notes and be thorough with them. Okay, doctor. Right. Thanks for responding. So yeah, it is good to read your notes, okay, if you have made them, and focus on high yielding topics. As I'm repeatedly telling you that there are a few topics which are really, really high yielding, like UTI, celiac disease. In nephrotic, nephrotic is also one of the important topic. Okay, please move task slide once more. Okay, I'll do it. Your internet connection was broken. Yeah, so these are the important resources for TS. Okay, if you want, you can take a note of it or maybe take a screenshot. So I'll move on to the next one. I was talking about last 2 months preparation. Okay, so yes, it's good to make notes and revise them and focus on high-yielding topics. You're welcome, Dr. AJ. And yes, make sure that you do at least 1 to 2 good revision of the content that you have already made and the concept that you have already made about the topic. Okay. Then invest half of your time in studying and half of your time in solving questions. So if you are in the initial phase of your preparation, or suppose if you are taking 6 months time in hand, and it is the first half of your preparation, you are supposed to do more of reading, okay, more of concept building, more of reading. And when it comes to second half of your preparation, that is last 3 months, last 2 months, it is advisable to give half of your time in reading in studying, and that will include studying fewer new topics which you haven't read before, and few of them which are a part of your revision. The other 50% time of your preparation you should invest in solving questions. Okay, how do you solve questions? So you can solve it in clinical cases. You have questions in form of recalls, and sample papers are also good sources, but I would advise you to do sample paper in the last 15-10 days of your preparation. Okay, so that you can feel the stimulation of giving your actual exam. Okay, so you can have a certain limited period of time set, and then you can start solving sample papers so that you understand how much time you need for each question. Okay, right. So yes, about solving questions, and we do have a huge question bank with our med exam expert as well, which will be provided for the ones who are being enrolled for the course. And yeah, manage your time well. Okay, manage your time well. Make sure that you have a good combination of reading, studying, revising, and solving questions, and then again analyzing your mistakes. Okay, right. So yes, recalls are must do, and especially you need to solve recalls of last 2 to 3 years, or maybe 4 years. If you have good time, you can fetch it till last 4 years. But when you solve recalls, you'll see that there are some different kind of questions and some different format, which won't be coming from third diet of 2024, okay, which it has already been said by RCPCH, and it has already been out in their website that from third diet of 2024, they are switching to just best of 5 single best answer format of questions, okay, right. Yeah, so identify your weak areas. Everyone has it. Everyone, it is good to know. It is important to identify your weak areas and work more on them. And right. So is it, there is a question that is it necessary to read SOP and illustrated textbook? So it depends, actually, if you are preparing for TAS, you need to know your SOP in and out, okay? It is very important if you're preparing for your TAS exam. And in that, for TAS illustrated textbook, you can let go if you do not have much time. But for FOP, it is advisable to be thorough with both the books. But still, if you do not have time and you need to switch to, you need to stick to one book, I would personally recommend SOP more than illustrated textbook of pediatrics, okay? I hope I solved it out. Right. So moving on. Yeah, you're welcome. Oh, now it is actually not moving for me. Do it. Right. So recalls for preparation. Okay. We are going to discuss about recalls in little depth because they are very important part of your preparation. And the first point that it is must do. Okay, please do justice to yourself. Please solve recalls and go. Okay, and in second half of the preparation, yeah, right. So when you are starting your preparation and you have good amount of time with yourself, I would say that it is better to stay away from recalls in the beginning part of your preparation, because it restricts you to certain kind of questions, which I would not want you to do if you are new to pediatrics and if you have good amount of time with yourself, right? But in the later half of your preparation, make sure you do them, okay? Then, yeah, recalls are available in two ways. It is some recalls, the PDF of recalls are available in such a way that it is topic wise also and it is year wise also. So what you can do for yourself is, when you're reading a topic, suppose today, if you have picked up respiratory system, you can go through your book, okay? You can have your concept clear, and then how to apply the knowledge that you have already learned can be done by solving questions of respiratory system from the recalls, okay? This is one good way of practicing. So yes, and also recalls are given year wise, as I told you, so that you have a better idea of how many years of recalls that you have to practice, okay? It is not advisable to go beyond 5 years, okay? Please do not solve very old questions, because as year pass by, the pattern changes and some questions are not important, because they are considered not important as the year progresses. So yes, and okay, how are the recalls different from the real questions? When I appeared for my exam for the first time, solving recalls seemed to be easier for me than the actual exam, because of the fact that, as I told you, recalls are a little shorter in length, okay? The questions have keywords sorted for you, okay? Because the students who have already appeared for the exam, they'll remember things which are important, things which help them fetch the answer, okay? They won't way, recalls are shorter, and the real exam has longer questions with them, which you can very well understand if you see the sample paper. Okay, and yes, so what is the right way of doing it? Okay, so understand one fact, that you cannot expect the exam to repeat same questions every year. So whenever you are solving recalls, please do not think the same question is going to come in my exam, and don't try to just mug it up. Okay, that is not the right way of doing it. What you have to take away from the recall is what aspect of the topic they want to assess you. Okay, so it tells you what topics are important. So you first of all get the important highly topics from the recalls, and then you go back to your book, you read that topic thoroughly, because next time I'm extremely sorry for the interruption. I'm sorry. And admins, can you please make me a co-host so that I can share? Okay, meanwhile, we had a question about, I guess, past test. Okay. So about past test, I would want to say that, it forms an important part of your preparation, yes. But to be honest, it has little or no role when it comes to preparing for TAS. Okay, so you can completely skip past test if you're preparing for TAS. But yes, it is helpful for FOP. Okay, when you're preparing for FOP, it does help you understand, what kind of questions are being asked. But if you have crunch of time, I would say that fastest is something which you can skip upon. Okay, I'm not recommending that, but if you honestly ask for my opinion, that if you are someone who has less time to prepare, and or you are busy with your job, you're doing it with your training and job, and you do not get time, I would say you can skip on fastest. I actually skipped it for the later half of my preparation. So you are asking SOP plus past test for both FOP and TAS? Yes, SOP plus past test for FOP, yes. A big yes, yes, yes. But when it comes to TAS, you can actually skip past test. Why am I saying that repeatedly is because past test has some questions in TS segment which are not important for the exam. Okay, so rather than wandering here and there and looking at topics which are actually not important for the exam, it is better if you stick to SOP, practice that repeatedly, and solve questions from sample papers, recalls, and the question banks. Okay, I'll just share. I'm sorry, just a minute. Okay. So is it visible now? Okay. Yeah, right. So we were talking about the right way of doing recalls. So know the topics thoroughly. Okay, the ones which are being assessed, which are the topics which have been assessed once in an exam, it is most likely to be repeated in another exam. Okay, the topic is likely to be repeated. Now, okay, when you are solving a recall, you must know which answer is correct. Okay, but you also need to know what options, why other options are wrong. Okay, you need to follow, the method of exclusion thing. Okay, you need to be able to exclude each options when you are doing your recall practice. Okay, so I'll show you how we have to do it with an example. And right. So let's solve a recall together. Okay. We have a 12-year-old boy with mild facial puffiness, with hematuria and proteinuria, along with cough and cold 3 days ago. Okay. The blood pressure recorded is 130 by 80. And they're asking what is the most likely pathology. Okay. So this question is of nephrology, and it was asked in TAS of February 2023. That was my exam. Okay, so what options are given here is increase mesangial IgA glomerular deposit, increase glomerular permeability to protein, increase tubular secretion of protein, and decrease angiotensin 2, loss of glomerular and ion charge. So I guess most of you must have reached to the answer by now, but I'll just tell you, explain you how you have to solve this question. Okay. So first of all, based on the uh, clinical scenario which you have been given, you need to pick up keywords. First of all, it is a 12-year-old boy. Okay. And this boy is having mild facial puffiness, so there is mild edema. Okay. And there is hematuria, proteinuria, definitely, and there is hypertension. Okay. The BP is high for the age which has been given, and then they are telling you that there is history of cough and cold 3 days ago. Okay, so this becomes a very, very important history. I'll tell you why. First of all, we have to, give it a broader classification if it is a nephrotic syndrome or if it is acute glomerulonephritis. So, based on the proteinuria, here the proteinuria, how much it is, they haven't mentioned. But in nephrotic, it is heavy proteinuria. In acute glomerulonephritis, there is mild proteinuria. And if you have to know the exact value of proteinuria, which is seen in nephrotic syndrome, so it is 200. It is more than 200 microgram per millimole. Okay, and when it comes to edema, there is marked or generalized edema seen in nephrotic syndrome, whereas in acute glomerulonephritis, there is mild edema seen. Okay, hematuria is present in acute GN, but it is not present in nephrotic syndrome. And hypertension again is present in acute GN, but it is seen only in advanced stages of nephrotic syndrome, nephritic syndrome. Okay, sorry, nephrotic syndrome. Yeah, I'm very sorry. And then oliguria is seen more commonly with acute glomerulonephritis, but when it comes to nephrotic syndrome, it is seen in advanced disease. Okay. Then comes hyperlipidemia and hypercoagulable states. Both of these are seen in nephrotic syndrome, but it is not seen in AGN. Okay. And coming to the pathogenesis, in nephrotic syndrome, the pathogenesis is variable depending upon the cause of nephrotic, if it is congenital or if it is, minimal change disease. But most of the times when a question about nephrotic syndrome is asked, they are trying to assess your knowledge about minimal change disease, because that is the most common pathology behind it. And minimal change disease happens because of effacement of podocytes, okay? Effacement of podocytes, which forms, it forms a component of the ultrafiltration of glomerular membrane, okay? And this particular pathology, that is effacement of podocytes, leads to proteinuria. And we say that there is more of albumin excreted in case of nephrotic syndrome, and there is hypoalbuminemia because of more and more selective albumin excretion, which particularly occurs because the electrical charge which is present on the glomerular basement membrane is disrupted, okay? So plasma albumin is negatively charged, and the glomerular barrier, which is present in the glomerular basement membrane, is also negatively charged. So these negative charges, they repel each other, and that is how albumin is not excreted, and it is spared. But this thing is disrupted in case of nephrotic syndrome, hence more of albuminuria happens, okay? Right. So talking about acute glomerulonephritis, the causes are variable, and we will see it in coming slides, okay? Pathogenesis is variable, and right. So causes of acute glomerulonephritis, there are four broad categories, that is immune complex deposits, then post-immune glomerulonephritis, anti-glomerular basement membrane, antibody-mediated glomerulonephritis, which happens in good pastures, and there are other miscellaneous causes of AGN. Okay. So whenever we are talking about immune complex mediated GN, the most common condition that we see is post-infectious GN, okay? And which mostly happens because of streptococcal infection. To be specific, this post-infectious glomerulonephritis happens secondary to infection of group A streptococcus, okay? Remember group A streptococcus, because sometimes they even ask you the organism in the TAS exam. And it can happen also secondary to other bacterial, viral, and rickettsial infection. And then comes HSP. HSP, the pathology behind it is also immune complex mediated GN. And then comes SLE. SLE is considered to be a secondary cause of acute glomerulonephritis, and that also has immune complex deposition in the glomerular membrane. Then comes IgA nephropathy. IgA nephropathy is also immune complex mediated, and it is one very important and common cause of acute glomerulonephritis, okay? Right. So coming to the next slide. This is a comprehensive table about, the different causes of acute glomerulonephritis and the clinical remarks. What are the important clinical keywords that you have to catch in the question? Some investigations which are important in the given condition, and also the pathogenesis behind this particular entity, okay? So yes, post-infectious glomerulonephritis, it happens a couple of weeks after the infection, after the streptococcal throat infection. So if a child has had streptococcal infection, just a minute, okay? Streptococcal infection, throat infection, then that child gets susceptible to post-infectious GN about 2 to 4 weeks after the throat infection, okay? But when it is happening after a skin infection, it usually takes 4 to 6 weeks for the acute post-infectious glomerulonephritis to develop, okay? So the duration between the infection, that is throat infection and skin infection, to development of AGN is different from throat to, skin infection, right? And then we have low complement C3 level seen in this condition. We have also increased SOP titer. SOP titer is positive in case of post-infectious glomerulonephritis, and anti-DNase B is positive in post-infectious GN. Okay, so the pathology behind it is immune complex mediated GN, and you can see deposits of IgG and C3 in the capillary loops and then the mesangial distribution. Also, in electron microscopy, there is typical lumpy, bumpy appearance in the subepithelium area. Okay. Then comes to IgA nephropathy. There is also macroscopic hematuria seen in it, and this also happens secondary to upper respiratory tract infection. But the catch here is the duration between the upper respiratory tract infection and the development of glomerulonephritis is just, 2 to 3 days, maybe 3 to 4 days. Okay, so a shorter history of, shorter past history of upper respiratory tract infection takes you towards IgA nephropathy. Okay, and also it is male predominant condition. Again, the pathology here is immune complex depositions seen, and specifically IgA, deposits of IgA is seen in the glomerular mesangium on the immunofluorescence. Also, C3 is also seen being deposited along with IgG and IgM. Okay, right. Then comes membranoproliferative glomerulonephritis. This occurs in older children and young adults, less commonly seen in early childhood, and it can have nephrotic and nephritic both pictures. Okay, either of it or maybe mixed picture. And here the pathology is immune complex mediated glomerulonephritis, and it has depositions in the intraglomerular mesangium again. Then comes your vasculitis, that is anti-neutrophil cytoplasmic antibodies, ANCA, associated glomerulonephritis. Now, it is of two types. We have the GPA, that is granulomatosis with polyangiitis, GPA, and the other condition is microscopic polyangiitis. Now, see, the important thing here is granulomatosis with polyangiitis. It was earlier known as vaginous granulomatosis, and the clinical scenario would give you a picture of kidney involvement in form of features of nephritis, glomerulonephritis like hematuria, proteinuria, and maybe hypertension will also be seen, and edema. But along with that, there will be features of respiratory tract also present. Okay, respiratory tract involvement may be in the form of severe pulmonary hemorrhage, or it may be localized in form of nasal septal involvement with cartilaginous collapse or chronic sinusitis. Okay, along with that, there will be other features of vasculitis like gangrene or mononeuritis multiplex. Okay, and yes, in some scenarios there is also involvement of ocular manifestation also. So you may also see unilateral or bilateral proptosis in this condition, that is GPA, granulomatosis with polyangiitis. Now, what is the pathogenesis involved in this? This is vasculitis. Okay, so there is pauci-immune vasculitis, and it is characterized by absence of any significant immunofluorescence finding. Okay, like we see in IgA nephropathy and PSGN. Here, there is no specific finding in immunofluorescence, but yes, there is involvement of small to medium sized vessels in GPA and also in microscopic polyangiitis, and you will specifically see cytoplasmic ANCA in GPA positive. Cytoplasmic, that is C ANCA, is positive in GPA, and P ANCA, that is perinuclear ANCA, is positive in case of microscopic polyangiitis. Okay, so this table explains you everything that you need to know about acute glomerulonephritis. Okay, especially when it comes to your FOP and TAS, this is all that you need to know in terms of nephrotic syndrome and in terms of acute glomerulonephritis. Okay, right. So moving on to the next slide, here there are some conditions which were not covered in the previous slide, which talks about conditions like Goodpasture disease. So you have case in your clinical cases of TAS about good pasture disease, where you have been given a child of, a young adult. You have been given you have been given a child who is into their teen, and they are having feature of acute glomerulonephritis. That is, there is proteinuria, there is hematuria, hypertension, and also there are findings of respiratory tract infection in form of hemoptysis. Okay, so when you have a condition which is renal and pulmonary, you need to think about good pasture disease. You need to think about vasculitis like GPA, and it is also seen in SLE. Okay, but the click is in that question, which is given in your clinical case of TAS, they have already given you the diagnosis of good pasture disease. So that is not something that you have to worry about in case of TAS. But in FOP, definitely you may be asked to make the diagnosis of good pasture disease. Okay, right. So what was the actual question which was given in clinical cases was, this is a patient who is having good pasture disease, and what are the investigation which will be expected to come up, expected to be positive in this condition? So the answer is anti-glomerular basement membrane antibodies. It is seen positive in case of good pasture disease. Okay, so this is how you reach out to a question with the help of recalls. With the help of recalls, you get to know what topics are important and how much in depth you need to learn that topic. Okay. Right. So coming back to the question, yes, most of you have reached to the answer. That is A. You will see increase in mesangial IgA glomerular deposits in case of this patient, because this patient is having mild edema, hematuria, and proteinuria, and there is history of cough and cold 3 days ago. As I told you, in IgA nephropathy, you have a shorter, interval between the upper respiratory tract infection and the onset of acute glomerulonephritis. Okay, right. So what about other option? See, the B option says that there is increased glomerular permeability to protein. Okay, so this is seen in most of the conditions which disrupt your glomerular basement membrane, and one of the most important cause being nephrotic syndrome. So in nephrotic syndrome, when the podocytes are gone, when the basement membrane, glomerular basement membrane is disrupted, there's increase in permeability to protein seen. Okay, right. So that won't be the answer in our case. Okay, then coming on to the third option, increase in tubular secretion of protein. Right. So you can see here, there are some common causes of proteinuria in children. Okay, out of which there are some variable causes which vary over time to time. That is orthostatic postural hematuria, proteinuria, and transient proteinuria, which may happen secondary to fever or UTI, and nephrotic syndrome. Others are fixed causes of proteinuria, like glomerular causes and non-glomerular causes. In glomerular, we have primary glomerular nephritis, which is, for example, your okay, and IgA will also come in it. Then you have glomerulonephritis secondary to systemic diseases like SLE. Okay, you have glomerulonephritis when it happens secondary to SLE. It is considered to be secondary glomerulonephritis. And then we have hereditary and familial nephropathies. We have some drug-induced glomerulonephritis and drug-induced glomerular cause of proteinuria. And then there are non-glomerular causes, which includes Fanconi syndrome and also acute tubular necrosis. So the reason why I came to this slide was to show you that in the question, C option says increased tubular secretion of protein. So this happens in case of tubular destruction. For example, acute tubular necrosis. Okay, so yeah, this option is also not applicable for this question. Okay, and then comes decrease angiotensin 2. Okay, so decrease angiotensin 2, which we do not in any condition, but we see it secondary to use of a drug, that is angiotensin converting enzyme inhibitor. Example, captopril and enalapril. Okay, these drugs, the basic mechanism behind them is inhibition of formation of angiotensin 2. Okay, and in case of ARBs, that is angiotensin receptor blockers, for example, losartan, they displace angiotensin 2 from its receptor. Okay, so basically they displace here, and in case of ACE inhibitors, they inhibit the formation of angiotensin 2. So this table is very, very important for your TAS exam, because mechanism of action of a drug is very, very, very common question for TAS. Okay, they want to assess your knowledge about the drugs that you are going to use. So pharmacological agents, drugs, they form a very important part of the management, and they want you to know how they act and what are the side effects of these drugs and in which condition they are used. Okay, so this is very important concerning your TAS exam. And yes, this is a very important table. And I got it here because we have one option, that is decrease angiotensin 2, which is done by ACE inhibitors, okay, not by any medical condition. And then the last option, that is loss of glomerular anion charge. It is seen in nephrotic syndrome. As I told you, in nephrotic syndrome, the charge which is present in the glomerular membrane, it is lost. Okay, they are negatively charged, and that negative charge is lost. Hence, the negatively charged albumin are increasingly excreted in case of nephrotic syndrome. So this was all about this particular question of recall. Okay, so I hope you guys are clear how informative a recall is. You know, every single question of recall is very important. You need to see the question being asked. You also need to see other options which are given to you. Just reaching out to the answer is not how you solve a recall, but you also need to see other options, because in the next slide, in the next setting, they might ask you something related to that. Okay, next time in the next exam, they might ask you mechanism of action of ACE inhibitors or ARBs. Okay, so yeah. So this was all about okay, so this was all about this webinar. And this is a quote which has been helping me throughout my days of preparation, and I still stick to it, that every bit of your soul to reach that one big goal. Okay, you have a goal, and you should have every bit of your soul working behind it. Okay, right. So I'm done from my part, and I would like to know if any of you have any questions, so that I can clear it here. And any sort of confusions, questions are most welcome. Okay, about clinical exam. If you have cleared your theory exam in 2021, and you are now looking forward to appear for your clinical exam, I would say that you need to first mark which diet you want to appear for. First of all, make yourself clear with which country you want to appear your clinical exam in, and it is always advisable to appear in your home country. Okay, so check in the schedule which is given by MRCPCH, that which is the upcoming exam in your home country, and exam is suitable for you, depending upon the time that you can spare for preparation. So if you want to appear for the minimum time that I would say is 6 months that you need to give yourself. So aim for an exam which is 6 months or above away from your starting point, and then start preparing for it. And then eventually you book for the exam around 2 to 3 months before your exam. And because you have appeared in 2021, most likely you would be considered, because it is quite a while since you have given your theory, so you would not be kept in the waiting list for a longer time. But be prepared if you are still kept in the waiting list, okay? Because that might happen. Most of the times it is a little disappointing for people. They keep preparing, and then in the end they get to know that they are not eligible. They are kept in the waiting list. In which order we should start preparing? First we go for SOP illustrated, or we should do clinical cases for FOP and TS? Okay, so this is a very good question. And I would want to tell you that, I had told this in the webinar also. If you have good amount of time with you, like for example, if you have 5 to 6 months with you in hand, start with the book first. Start, focus upon clearing your concepts. Focus your energy on understanding a topic, understanding a disease condition, okay? And then you can start solving clinical cases in the second half of your preparation. But Dr. AJ, I would want to know when are you going to appear for your exam, so that I can tell you better if you need to, how do you need to do it? Because if you are really short of time, okay, like suppose if you are just 2 months away from your exam, that then you'll have to even skip on the clinical cases. It is not at all advisable, but because if someone is having this less time, then other things become more important than clinical cases. So yes, if it is February 2025, definitely you have good amount of time with you. Okay, that's good if you are trained MD pediatrics also. So what you can do is you can start your preparation with the this thing, science of pediatrics, okay? And because you are trained pediatrician, then you won't be requiring, it's okay if you do not read illustrated book of pediatrics, but read science of pediatrics in and out. It is a very, very important book. And if you can include illustrated textbook, then it is good, okay? They have good pictures also, and pictures are also important when it comes to FOP exam. And okay, no worries. Even if you have started your training just now, it's still good for you, okay? You are dealing with pediatrics in your everyday life, so you are still close to it, don't worry. So yes, you can include illustrated textbook in your preparation. They have good images, okay? And later on, when you are some 2 to 3 months away from your exam, you can start solving clinical cases. Or you can also do it in this way, that if you pick up a topic like GIT, you read GIT from Science of Pediatrics, and then you go on to solve questions related to GIT from your clinical cases, okay? So that is a good way of doing it. It is advisable also. Yes, so any more questions? I hope I cleared your doubt, Dr. AJ. Okay. Yes, so is there any more queries? Feel free to ask your doubts here. I'm there to solve it. And if you want, you can even reach out to us with the WhatsApp group of MedExam expert. And about the question bank, Dr. AJ, well, most of the question banks are based upon recalls. So recalls, anything concerning recalls is must do, okay? And
Here in our course, we have some question banks which are prepared in the MedExam Expert by the MedExam Expert group, which is available to students who enroll for the course, right? And you were asking about like PAS medicine in MRCP medicine. Okay, I understood. So this way, if you're asking about such question banks, then yes, PAS test is something which you can go for. PAS test is a good, set of question banks which you have for your FOP and AKP preparation. But again, for TAS, it has a lot of things which are the syllabus, I would say, concerning MRCPCH. So it's okay, or it's rather better if you skip it for TAS exam. Okay. Then there is another question, anything except past test. Okay, so you have few questions given to you in SOP itself. SOP and Illustrated Textbook of Pediatrics have a few of the MCQs given to you within the text. So they are important and they are informative. And apart from that, I would not want you to wander here and there much for question bank, because I would rather say the questions which are given in the form of recalls, clinical cases, sample paper, and past test is good in amount to make you understand what kind of questions are asked and how the questions are asked. So it is better to focus more on the concept building related to the topics which are being assessed. I hope I answered your question. You're welcome, Shraddha. What's passing ratio for fresh candidates for part 1? Mr. AJ, Dr. AJ, I can understand your anxiety related to the exam, but I would say that do not worry about the passing rate, okay? I told you in the beginning of the session also that this exam is doable, and especially for we student in the South Asian countries, we have we have a very good and intense training in the medical and the healthcare. Okay, so and we also have the very good habit of working hard. Okay, and that way, if you are training in MD pediatrics, I would assume that you have worked hard in the past. Okay, and if it is, yes, in Pakistan also it is, yeah, definitely it is tougher. Okay, I understand that. So if you have cleared your exams and reached a level where you are currently, you will definitely make it in the first attempt. Do not worry. Okay, just that stick to your basics and avoid experimenting a lot. Follow the basic protocol of knowing exam and working according to the exam. Okay. Yeah, you're welcome, Dr. AJ. Any more questions, doctors? I have passed FCPS pediatrics. Can I pass exam with? Yeah. Can I pass exam with 2 months preparation, because my practice is not allowing to have more time on this exam? Okay, doctor. So, okay. So see, it is advisable to have, good time and good interval before you appear for this exam. But if you are someone who has already done FCPS pediatrics, I assume that you have good, basic knowledge about pediatrics. So I would say that yes, you can do it with 2 months of preparation, and it is not undoable. But these last 2 months, you have to focus. You have to focus a lot and put all your energy into the preparation. you do have the basic knowledge. That is a good thing. As I said, I assume that you definitely have that basic knowledge, and I even assume that you have in fact, really good in-depth knowledge also, as you have passed your FCPS. So yes, you can do it in 2 months, but make sure that you put all your energy into the preparation in the last 2 months, and do not really go on to experimenting with a lot of resources. Okay, as I told you, there are a lot of resources available on internet, but make sure that you stick to the ones which are high yielding. Okay. Yes, you're welcome, Dr. R. Dr. M140. Okay. Do you have any idea about MRCPCH can give FCPS exit exam and get FCPS degree here in Park? Okay, so Dr. AJ, I'm very sorry, I do not have much idea about that. How is MRCPCH and FCPS degree related in the way that you are talking? But I can find it out for you and let you know. You can reach out to us in the WhatsApp group, the free WhatsApp group of Med Exam Expert. Okay, you can reach out to us there and just remind it to me there so that I can answer it to you. Okay, there. Right. Is recalls and samples available in your course? Definitely, Dr. Shraddha. We have recalls of last almost up to 2015 and 16. Okay, we have all the recalls available with us, and we even have a good set of question bank with us. Okay, which is made by the group of Med Exam Expert. Okay, and what more did you ask? Yeah, samples also we have. We also conduct mock exams. Okay, which is similar to the exam that you will be appearing. Okay, in future. Yes, you can appear in FCPS exam. Okay, how long is the course? So, Dr. Shraddha, our crash course is of 6 weeks. Okay, and we have divided it into FOP and TS preparation, so that you know it better, that how much you are well prepared in your TS and how much in FOP. And we have two I'm one of your mentor, and we have Dr. Nida also. She is also an expert, and she has a lot of experience in pediatrics. We'll be guiding you throughout the course. And the example that I gave you in today's recall practice, we will be doing it in a similar way. We'll be providing you with a lot of tables, flow charts, which will be a comprised version of what you have in your Science of Pediatrics illustrated textbook, clinical cases, and other important resource material for preparation of MRCPCH. So all the hard work that you actually have to do, we will be doing it for you, and serving it to you in a easy to understand and easy to learn way. Okay, so it is actually, the homework has to be done by us to give it to you in a simpler and concise way, so that we can complete the course in 6 weeks and make you prepared for the exam. Yeah, starter, you can say. Also in the course, we will be discussing recalls also. Okay, so the way we have expanded today's recall was a kind of a small trailer about the course that we are going to have. You're welcome, Dr. Shraddha. So any more questions, dear doctors? please the WhatsApp group. Dr. Shraddha, I guess you are asking about the link of the WhatsApp group. My team will be sending you one, okay? Dear admins, can you please share the link of the WhatsApp group? Yeah. Yeah, so my team will be sharing it to you, Dr. Shraddha. And if you have any more queries related to the course, you can talk to our teammates and they'll brief you up completely about the course that we are going to have. And if you have any more queries specifically you want to ask me, you can also reach out to the team members and they will direct you to me, okay? Any more questions? Okay. 6 weeks course for FOP and TS. Can I just focus on TS now? Dr. Shraddha, I did not get your question. 6 weeks course for TS and FOP. Yes, our course, crash course, is a 6 weeks course, and it aims to, give you the most highlighting topics in the last moment of the exam so that you are fresh with them. And, it will be dealing with all the recent recalls and about the clinical cases and about the gist of SOP, illustrated textbooks, and, the other important resources for MRCPCH. Okay, so if you want to appear for only TAS as of now, so yes, you can reach out to the team. You can reach out to the team and they'll help you in a better way. So yes, you can talk to admin. The admin, please help Dr. Shraddha with this. And yes, you can do that. You can just focus on TS for now. Right. You're welcome. That's good. That's good. Okay, so here you have the link, Dr. Shraddha, Dr. AJ. If you have any queries, you can directly contact on this link. And yes. So any more doubts for the session? You're welcome. Bye. So thank you all for your patient listening and all the best to all of you.